to the channel. So today in this video we are going to cover some questions which is very important for your railway pharmacist exam. And here we have a first question is that IR spectroscopy is used for, and the options are: option A is drug receptor interaction, option B is functional group identification, option C is polymerization, option D is conformational properties. So IR spectroscopy is used for, and the correct answer is it is used for the functional group identification. So let's discuss with the help of explanation. Here we have just a simple explanation that the entire IR region is broadly classified into group frequency region and the fingerprint region, and the group frequency region is to 4000 to 1500 centimeter inverse, and fingerprint region is to 1500 to 400 centimeter inverse. Students, sometimes the question may also ask that which is the fingerprint region and what is the range, so you have to tell about this one. And in the frequency, in the group frequency region, the peaks corresponding to the different functional groups can be observed, like example amino group having different and alcohol group having different. So every part of molecule has different atoms and are connected by bonds. Each bond requires different IR region for the absorption, and so characteristic peaks observed. Hence this region is referred as fingerprint region of the molecule. Now the next question is: a certain number of men can do a work in 60 days. If there were 8 men more, it could be finished in 10 days less. How many men were there in the beginning? So we have to tell about that at starting how many men are there, and the options are: option A is 40, option B is 35, option C is 45, option D is 50. So the correct answer is 40 are the men who is needed in the starting one. Let's discuss with the help of explanation. Let there be m men. Okay, just we have to assume, and originally to work in 60 days. If the men were m plus 8, the work would be completed in 50 days. So m plus 8 by m is equal to 60 by 50. So what is the value of m? Is 40. So hence 40 is the correct answer. Now the next question is: desert plants are generally, option A is viviparous, option B is succulent, option C is herbaceous, option D is heterophyllous. So desert plants are generally, what is the correct answer, students? It is succulents. Desert plants are succulents. Here we have explanation on that. What is succulent actually? It is a plant that stores water for times when water is not available to it. Actually, and succulent plants are generally found in arid environments such as deserts or semi-deserts. So students, this is all about this question. Moving on the next question. Gray baby syndrome is caused by, and the options are: option A is chlorpromazine, option B is chloramphenicol, option C is phenytoin, option D is gentamicin. So gray baby syndrome is caused by which drug? And it is the most important question asked in every competitive exam. So we have to tell about the correct answer. What is the correct answer, students? The correct answer is chloramphenicol. Chloramphenicol having the gray baby syndrome side effect. So let's discuss with the help of explanation that what is actually gray baby syndrome. That a syndrome is due to toxicity of the antibiotic, that is a chloramphenicol, in the newborn, especially the premature newborn, because of the lack of necessary liver enzymes to metabolize this drug. Where chloramphenicol accumulates in the baby, causing hypotension, cyanosis, means blue coloring of lips, nail beds, and skin from lack of oxygen in the blood, and often death. It is therefore usually not given to newborn or premature babies. So the correct answer is chloramphenicol. Here we have just a simple indication of chloramphenicol side effect. It is having lethargic eyes and pale of blue skin. Now next question is, which of the following is topical sulfonamide? We have to tell about this topical sulfonamide. Options are sulfacetamide, option B is mefenide, option C is sulfamoxazole, option D is none of the above. So which is the correct answer? The correct answer is mefenide. Mefenide is the topical sulfonamide. Students, this is some technical problem. So mefenide is the topical sulfonamide. Here we have explanation or classification of sulfonamide, that there are 4 classes: short acting. Short actings are sulfadiazine, sulfamidine and sulfacetamide, where intermediate acting sulfamethoxazole and long acting are sulfadoxine, sulfamethoxypyrazine, sulfadimethoxine, etc. And topical used mefenide, sulfur, sulfadiazine and sulfacetamide. For ulcerative colitis, the sulfasalazine is used. So this is all about this question, students. Just try to note down the classification of this. Now, here we have a first nuclear plants in India. So the correct answer is Tarapur, Maharashtra. Which of the following protein in the hair is elastin, so next question is, which of the following protein hair is, options are, option A is elastin, option B is prolamine, option C is keratin, option D is gliadin. So which of the following protein in hair is, and the correct answer is keratin. Keratin is present in our hair. Now let's discuss with the help of explanation that here we have just structure of hair, and 80 to 85% of your hair is composed of a protein called keratin, and it is a schematic of hair fiber. So students, 80 to 85% are present are keratin. So now next question is, the abdominal syndrome, flu syndrome is adverse effect of, and the options are isoniazid, option B is rifampicin, option C is ketoconazole, or option D is terbinafine. So which of the drug is having the abdominal syndrome and flu syndrome? The correct answer is rifampicin. Rifampicin having the abdominal syndrome and flu syndrome. So let's discuss with the help of explanation that rifampicin is an having abdominal syndrome, flu syndrome, cutaneous syndrome. So just try to note down like this: AFC syndrome done by rifampicin. And hepatotoxicity and discoloration of urine is also the side effect of rifampicin. Students, sometimes it is also asked that which drug shows the discoloration in urine. As the correct answer, rifampicin. So isoniazid having the peripheral neuropathy, hepatitis and hemolysis, where ketoconazole having nausea and vomiting, and gynecomastia and oligozoospermia. These are the side effects. And terbinafine having diarrhea and headache. So students, the rifampicin is the correct answer, which is having the flu syndrome, abdominal syndrome and cutaneous syndrome. Now moving on the next question, which of the following alkaloid is liquid and volatile in nature? And the options are, option A is conine, option B is aspartame, option C is nicotine, option D is all of the above. So which of the following alkaloid is liquid and volatile in nature? The correct answer is all, means conine, aspartame, nicotine are the liquid and volatile in nature. These are the alkaloid class. So let's discuss with the help of explanation that alkaloids, liquid and volatile in nature, choline, aspartame and nicotine are the liquid and volatile in nature, where colored alkaloids are betadine is red, berberine is yellow, and its salts are copper red in color. So let's move on next question. The first line drug for Burkitt's lymphoma is, and the options are doxorubicin, option B is actinomycin D, option C is cyclophosphamide, option D is vinblastine. So the first line drug for the Burkitt's lymphoma is, and the correct answer is cyclophosphamide is used for the first line of Burkitt's lymphoma. Students, you can also learn like this: B and C, BCL. You can also just try to make a mnemonics of learning. Now, Burkitt lymphoma. Burkitt lymphoma, it is a form of non-Hodgkin lymphoma in which cancer starts in immune cells called B cells and recognized as the fastest growing human tumor. Burkitt lymphoma is associated with impaired immunity and is rapidly fatal if left untreated. And cyclophosphamide is the first line drugs for Hodgkin's types of cancer. Now the next question is, the genetically determined unwanted reactivity to chemicals or drug is called, options are, option is intolerance, option B is drug allergy, option C is idiosyncrasy, option D is poisoning. So the genetically determined unwanted reactivity to chemicals or drug is called as, and the correct answer is idiosyncrasy. Let's discuss with the help of explanation that what actually poisoning is and intolerance and idiosyncrasy. So first on poisoning. It is a broad sense. Poisoning implies harmful effects of a chemical on a biological system, where intolerance is, it is the appearance of characteristic toxic effects of a drug in individual at the therapeutic dose. And coming on idiosyncrasy, it is a genetically determined abnormal reactivity to a chemical. Means someone is taking the aspirin, and if it is having the allergic by birth to the aspirin, then it is came into the idiosyncrasy class. And that what is drug allergy? That drug allergy is a immunological mediated reaction producing stereotype symptoms which are unrelated to the pharmacodynamic profile of the drug, generally occur even with much smaller doses and have a different course of onset and duration. So students, idiosyncrasy is the answer. So moving on the next question, that to which one of the following ministry Nirmal Gram Puraskar Award is related, and the options are Ministry of Environment and Forest, option B is Ministry of Rural Development, option C is Ministry of Culture, option D is Ministry of Social Welfare. So which is the correct answer? The correct answer is that Ministry of Rural Development is the award with Nirmal Gram Puraskar, and it is related with. Now next question is, when is the International Day Against Drug Abuse and Illicit Trafficking is observed, and the options are, option A is June 26, option B 22, option 28, option D is June 24. So the correct answer is that on June 26, the International Day Against Drug Abuse and Illicit Trafficking is observed. Now just we have to solve this, that look at this series: 70, 71, 76, missing one, 81, 86, 70 and 91. What number should fill the blank? Options are option 70, option B is 71, option C is 80, option D is 86. So we have to just, students, observe the gap, that how it follows, that it is a 1 gap, it is a 5 gap, so after that what should be, and it is a 5 gap again, and after that it is also the 4 gap. So according to this, the correct answer is the 70. How it will happen? Let's discuss with the help of explanation, that in the series 5 is added to the previous number, the number is 50 inserted as every third number. So 70 is the correct answer. Now next question and last question of this video, students. all arteries carry oxygenated blood except coronary artery, option B is pulmonary artery, option C is carotid artery, option D is sublingual artery. So all arteries carry oxygenated blood except pulmonary artery. Pulmonary artery carry deoxygenated blood. Here we have just a blood movement. That left ventricle pumps the oxygenated blood to the body, and right ventricle pumps oxygenated blood to the lungs, and all arteries except pulmonary artery carry oxygenated bloods, and all veins except pulmonary vein carry deoxygenated blood. Students, just try to note down these two short points. Okay, so students, this is all about this video. Thanks for watching.